Welcome back, everybody. This is 7 Minutes for Seniors. I am Chris Wilson with Modified Independence, and I'm here with my friend Rachel Noameshie from the MPH Life. If you were watching yesterday, we got a little intro to her. And of course, if you didn't watch yesterday, make sure you go back and watch it. Today's our second segment, so we'll go right into it. How exactly, in terms of the MPH life, because I know you're a nurse practitioner and you work for somebody else. This is their like side hustle, not primary hustle, right?
Yes.
So how exactly does the MPH life, your role with the MPH life, how do you help seniors?
Okay. So, with the background of nurse practitioner, I have to say I'm not replacing your provider. My background is primary care, internal medicine mostly. So, I'm not replacing your main provider. However, I am the person in between your doctor's visit. I am the person when you have questions, you are not sure, or you are having a hard time getting a hold of whichever service or specialty you should be getting a hold of when you are not sure. Even sometimes it comes down to being able to express the need or the issue, because sometimes you don't know this the senior or the family are not even sure what is the need. So that's where I come in. So I do use my education, I do use my background. I'm very heavy on medications. Again, I'm not like an oncologist, I'm not, those specific specialties, but in terms of global view of medications and side effects, that's where I come into. Oftentimes, I've seen duplicate treatment,
Mm-hmm.
because a new treatment is started. The instruction is typically given stop, or sometimes it is missed. Stop the previous treatment, and so it's not done. And so there's double treatment going on with the side effects, or if there are no obvious side effects, it's still your liver or your kidneys or whichever organ that has to deal with it. So that's how I help, and also with services sometimes setting up, identify the services that are needed to stay healthy, stay out of the hospital, and really just having dignity of life, and then presenting those services and helping getting those services established, especially if it means trying to get the primary care to order it and
Mm-hmm.
things like that.
So this is a concierge service. It's not something that's paid for by insurance, right?
Yes, the insurance covers some service. If you were to need my services, I can speak to you. I will have to talk to your primary care physician, and they need to okay me to be providing the services for you.
And you can go to the doctor's appointment with them.
I can go to the doctor's appointment if they request. Um, my services are changing to a virtual aspect too.
Mm-hmm.
So at this point, what I do is really get a hold of the doctors and review the records, have access to the record, and directly ask the clinic or the physician exactly what the plan is, and then being able to explain it to them.
Right.
Um,
Because there's a healthcare literacy component to this,
yes,
right?
yes,
we
yes,
already we already have a literacy problem in this country, and then
yes,
when you add complicated healthcare terms on top of it
yes,
to
yes,
somebody who is already sick and everything like that.
yes.
I've been that patient before. When I was younger and I got hurt, I didn't have the healthcare literacy that I do
Mhm,
now, and I didn't have anybody advocating for me.
mhm.
In fact, it felt like everybody was actually advocating against me, and it ended up causing a huge change in my life.
Yes,
You know, so it's very important to have that advocate who can
yes,
speak the language to the providers for you,
yes.
so you don't have to worry about anything other than getting better,
Yes,
right?
that's it. That's it. I'm thinking about a case recently where I did not know it is after the fact, but because it was an emergency and so many things happened, so many specialists were seen, but and these are people my age. At the ending of the day, they could not piece together what all was going on.
Mm-hmm.
Educated people, but they are like, nobody is explaining to us
Right.
what all this means, and at the ending of the day, what happened, how do we prevent this, you know so I was given access to the records by the people. I had access to the record where I could review everything every single provider was saying about this case, and then explain that to them.
Mm-hmm.
This is what this person, this is why this was, and this is, and all of those things. So yes, even if I may not come to the appointment with you, I can still address, it's just a matter of me accessing records. There has to be like the release and things like that. And then I can explain it back.
Because it's very rare in our healthcare system that any one doctor is going to review all the records,
Yes.
right? They're going to look at what their specialty is,
Yes.
and then whatever comes from the primary physician that sends you to them. But they're not going to look at all of those other things, and a lot of
Yes.
times things get missed because everybody is too busy focusing on
Yes.
the small piece
Yes.
and not the bigger piece that's going on.
And let's be realistic. There's the way, from my perspective, the healthcare is now how busy it is and the time constraint. I'm not. I can say it for myself. There is the time constraint. So even if you really want to review everything, it is not always possible.
Right.
So you do your best and you get information and really you do your best, but oftentimes at the end of the day, lots of patients still have lots of questions. So
yeah,
that's where
I know we're dealing with that with my wife now, like with her issue with Crohn's. It's like talking to a gastroenterologist who says that this really belongs to the colorectal surgeon, and the colorectal surgeon says, well, talk to my resident. I told my wife with her last appointment, like, talk to the resident. So she goes in, and she had this great rapport with the resident before. She goes in this time, and the doctor's got a new resident. So it's like it's starting all over again. So thankfully, through groups and stuff like that, my wife has been able to raise her healthcare literacy when it comes to that. But it's still it's still a significant thing trying to keep up with those things. So I would guess that your ideal client is somebody who has something, either is planning ahead for aging, right? Because we only get to do it once. We're all a rookie at getting older every day, right? So somebody who is planning on aging and wants that advocacy part, or somebody who's in a catastrophic situation and feels like somebody is taking a microscopic view instead of a macroscopic view. Would you agree with that?
Yes, definitely will agree with that. Planning aging, the catastrophic situations, multiple diseases, chronic diseases, a lot of the chronic diseases too, and then multiple conditions, and trying to make sense of any of those things. In terms of planning aging, it boils down to what you may be dealing with now, and then how to really mitigate those, how can I say, the long-term effects or things like that. And sometimes I even talk to financial advisors because as they are helping their clients plan ahead, they have to also think about the healthcare portion of it. And
sometimes you might even talk to an occupational therapist to make sure that they stay safe in their home.
Yes,
right?
Oftentimes, not sometimes, oftentimes, especially after a life-changing event, and so there is some weakness or there's some deficit, or now there are new equipments to use and all kind of things. Oftentimes, so yeah, those are good clients, as well as folks that want to stay healthy.
Yeah,
because I still do my health coaching is not the typical, although I'm a big believer, although I'm a, how can I say, Western medicine trend, I'm also a big believer in a holistic approach. Yes, there is a medication for everything, but do you really want to be in a place where you have to take medications for it? Can you control it? Can you avoid? Can you delay the onset? So those type of things.
Awesome. Well, that's been our second segment of 7 Minutes for Seniors. We'll be back again tomorrow. Thank you very much. If you need her to reach out to you or to reach out to her, her information's coming up next, and we will see you again tomorrow. Thank you.